Welcome to Community News Media, and we're here with another episode on pickleball, the fastest growing sport in the nation. So today, my guest is Audrey Lugo. Welcome, Audrey. I just want to say a few things about you. Audrey is a physical therapist. She's a dance medicine specialist, strength training coach. She earned her doctorate in physical therapy from Nova Southeastern University with a dance career spanning from the age of 3 to the pre-professional level. She experienced several dance-related injuries that led her passion for physical therapy, strength, and performance in the dance world. Audrey is adamant on the importance of every individual experience a treatment plan tailored to their specific needs. She specializes in functional training and therapy that incorporates strength, mobility, flexibility, and balance. And with your extensive background in the unique sports medicine arena, the demands of dance, along with your own experience as a high-level dancer, Audrey understands the needs of these artist athletes that prioritize injury risk reduction and strength for your clients to continue your growth for what you do. So welcome. It was like a mouthful.
Yeah. Thank you so much.
Welcome and welcome to our show. So you work for Old Bull Athletics. You're their therapist. So tell it, first of all, who Old Bull Athletics, what do you do, and what is Old Bull Athletics?
So I'm Dr. Audrey Lugo. Like you said, I'm a doctor of physical therapy and strength and conditioning specialist as well. And at Old Bull Athletics, we exist on the continuum of healthcare. So we have physical therapists, we have strength coaches, and we have physical therapists who are strength coaches as well. So that allows us to treat every individual according to what their current needs are. If they have an injury with physical therapy, we're able to help them overcome that injury and heal from it. And then we transition them to a strength and wellness program so that they can continue, exceeding their expectations of why they even walked in the first place and just getting stronger. We also treat people who are not injured, and we just help them get stronger and achieve whatever goals that they have and help them get to that point.
So do you do strength training as well?
Yes.
Not just therapy?
Exactly. So we have some clients that see us exclusively for physical therapy, but because we're able to exist on this continuum of healthcare, we can transition them into strength and wellness. But separately, we also see people who just want strength training. Maybe they're not injured.
Correct.
And they're able to be trained and treated and looked at by a doctor of physical therapy that also has a background in strength training as well.
Got it. So, okay, since we're here to talk about pickleball, and we do see lots of injuries with pickleball.
Yes.
So tell us, what's your experience with that?
Yeah,
And
so
what do you recommend?
right, pickleball, I mean, you're on the court. It's a lot of repetitive motion, a lot of running back and forth. There's a lot on the lower extremity, right? So hip, knees, ankles, sometimes back, and also the swing. What I recommend for people who might be in pain with pickleball, definitely go see a physical therapist, because that person can help you with overcoming your injury, as well as not having to stop, playing your passion, because that's the whole goal, is you don't have to stop to
Right.
heal. You can heal while you're still continuing your passion. So definitely seeing a professional that can help you with your injury, but also, treat you in a way that you don't have to stop what you're doing. You can continue.
So, like, I'm a pickleball player, obviously.
Yeah.
My shoulder constantly getting hurt, constantly. Right? I don't know, your rotator cuff or whatever this is, it's always getting hurt. So, do you recommend, any kind of a stretching technique? Do you recommend, having obviously the physical therapy, but any kind of workout that would help?
Yeah, absolutely. There's, like we discussed, there's a lot of demands in the shoulder, and you yourself experiencing some shoulder pain, and that must be somewhat limiting you in your passion, whether it's
Right.
whether it's obvious or not, right? It might be uncomfortable.
Right.
So as physical therapists, we also just treat with telling you, let's strengthen your shoulder. It's not always just, oh, I'm tight. It's also maybe there's a lack of strength there that we can increase the strength. We can also increase stabilization, right? Because you're moving, there's a lot of swing. So the shoulder has to know where it is in space too.
Exactly.
So part of that is that stabilization, that strengthening, and maybe there are some structures that are tight, that there's specific stretches. So it's definitely looking at the whole picture, right? We're not just looking at, oh, it just hurts with this. Well, maybe there's some other areas. Maybe you're compensating in your swing. Maybe you're not, fully using your shoulder like you could be. Maybe some muscles need to be worked on, or we need to strengthen some muscles so that they can also help you in your swing and you're not just compensating in another area. So we definitely, as physical therapists, and something I'm fortunate to do at working at Old Bull, is we're able to look at the whole picture. We're not just, specific on one thing, and we can really dive in and see kind of where is this pain coming from and how can we help you.
So you're not just, like just a gym or just like a therapy or an not occupational, physical therapy place. You do more than just that. You assess the problem and help with whatever. So what would is that what would separate you from other places?
Sure. The way I would say is we're pretty non-traditional. I don't know if you've had experience going to a physical therapy facility ever, but we're a non-traditional place where we're not a gym. We're also not just a physical therapy facility. We don't have these barriers to limit the quality and the type of care that we're able to provide. So we don't even need you to bring in a diagnosis. And even in the state of Florida, you could see us direct access. So you don't need to see a physician or anything first. You can come to us directly and just give us your concerns, and we can treat you from there. And
Do
progress.
you take insurance?
We don't take insurance, actually. We're a cash-based facility.
Okay.
So at the moment we don't. And that actually is one of the things that allows us to not have these barriers of insurance, where we're able to just treat you one-on-one. So your time, and when you come in, you're seen by a doctor, only a doctor, and you're with us for the whole hour. And we're able to provide you with a plan of care specific to your individual needs and your individual goals. So that's kind of how we're able to see the whole picture. You could come in for your shoulder, but you could also say, hey, also I have something with my knee. And I don't have to just say, well, sorry, we're only here for your shoulder. We could see everything.
Right.
So that's kind of one of those things that separates us from
other facilities. How many people do you see that are out and out pickleball players? Since this whole new phenomenon with pickleball has erupted in the last, year.
I was going to say it's quite a few, because pickleball is something that can be played any age. It's really grown a lot. And I was having a conversation the other day. I feel like it's kind of out of nowhere now. I'm hearing pickleball everywhere. So I've definitely seen different populations, and it's definitely picking up in popularity. I've seen.
It definitely has. Do you all see a lot of pickleball players in your facility?
I've seen a few, yeah. I mean, some of them, it's not like professional pickleball or even super serious, but just
like me.
Yeah, exactly. Like as a sport, as a hobby, yeah.
People are coming in that
People
are
are
injured.
coming in, and they're injured, or they just want to be feeling good too. So that's another thing about my facility is you don't also have to be injured to seek wanting some improvement. You don't have to come in with like, oh, I'm just in this tons of pain. You could just come in wanting to, get better in your skill set and in your performance.
So what recommendations can you give to our audience, our pickleball players that are watching this show, that would want some advice on what they need to do before they start playing?
Yeah, so I'd always recommend, a proper warm-up. You want your warm-up to be dynamic, and you want it to sort of mimic the demands of the sport and the activity that you're about to play too. So, there's definitely the time and place to do your stretching and everything, but you want to make sure you're getting your heart rate up, you're moving around, you're warming up all of your muscles, because pickleball is a pretty dynamic sport. So you're running around the court, side to side, lateral movements, forward and back. Your arm is working and swinging. Your knees are bending, your ankles, everything. So you want to warm up the whole body really, and just make sure that you're ready to go and play. And you don't want to do a sport cold ever. You want to make sure you have a proper warm up and you take the time for that, as well as proper hydration. That's always something very important, and staying hydrated, making sure that after your pickleball, maybe that's a good time for a cool down as well.
Right.
And just staying conditioned in that aspect.
Would you recommend people doing training if they're playing pickleball, that doing like weight training or some type of functional training will help them with their game?
Oh, absolutely. Absolutely. And it's one of those things, it's not just going to be in your game that you're going to see, improvements to quality of life. It's going to be in your daily life as well. So I'm very passionate about functional and weightlifting and all of that, because, as you do age and as you do go through life, you do need that resistance against your muscles to make strong muscles, strong bones, and to help you, as you go through life, staying strong and staying injury free.
Right. So tell us about your background, a little bit about you. You were a dancer.
Yes.
So tell us a little bit about what you've done.
Yeah, so I was a dancer, as you mentioned earlier, since a very, very young age. It was my first love, my first passion, and I really wanted to pursue it professionally. It was in those teenage high school years that not the proper taking care of my body, and in terms of rest, nutrition, and also listening to my body when my body needed more rest and trying to push through, I developed a lot of overuse, repetitive type of injuries. So nothing like traumatic of an injury, but definitely chronic pain, fatigue, and that sort of nature. So that kind of made me need to take a break from dance, and I worked with a physical therapist that kind of inspired me that,
So that's how you got into what
exactly.
you're doing
I was
now.
a patient first.
You were, right. That's typically how that goes.
And it typically is. Yeah. So that kind of, shifted my perspective and said, okay, well, I want to be able to help people now too, where they don't have to get to the point that because they're so passionate about what they do and that they don't want to stop,
right.
They get injured. So I can shift this and make it so now I can help people not get to that point. So that's kind of what led me to physical therapy. So I got my undergraduate degree at Florida State University, and then I got my doctorate degree at Nova Southeastern. Go Noles, yes.
Go Noles. My girls went to FSU.
Oh, wonderful, yes. Okay. So that's where I went for my undergrad. My doctorate I did at Nova Southeastern University in Davie. And now I am very fortunate to work at Old Bull Athletics here in Pinecrest. And
does Old Bull Athletics have another location? Or
yeah, our first location was actually in Coral Gables.
Okay.
So this is our newest location in Pinecrest that we just opened up a couple months ago.
Okay. Well, that's wonderful. Well, congratulations on all of that.
Yes.
That's we're happy to hear that. So let me ask you this: what, like the age groups that are coming in for therapy, and what ages are you seeing people are getting injured? What types of sports and that type of thing?
Well, so like I mentioned, we don't only see injuries too. We see people that just want
to come in and do training.
So I mean, my youngest client that I've seen since working here has been 4. And my oldest has been, 70s. So definitely the whole.
You run the gamut.
The whole range, yeah. Any population, we don't treat a specific population. We're all general population, right? There's no need to specify. So we treat everybody like an athlete. We help everybody get to their goals. So huge range.
Okay, that's wonderful. And now, the thing is with pickleball, you can be on the court and have a great game, and then afterwards you'll be in so much pain, whether it's your knee or you have your shoulder or your hip, whatever the case may be. So it's something that as pickleball players, we need to constantly be conditioned and training and stretching. So if you can give our viewers any great stretching techniques that they can do, that would be wonderful.
Yeah, so I mean, you want to make sure your hamstrings are stretched out, your quads.
So use like a
Yeah,
bar or
you
something.
can use a bar to put your leg on. I mean, one thing I like to show people too is like just using a chair. Everybody has a chair at home
Of
that you can
course, yeah.
put your foot on and just kind of hinge your hips forward, feel a nice stretch in your hamstrings.
Because that will make you a little looser, especially when you're running after the ball. And
absolutely, you want your legs to be ready to go, right? Quads too. Sometimes people can experience some tightness in their quad. So classic, trying to grab the ankle behind you and stretch your quad. You could also do it laying down, and your calves too. There's a lot of running around, so sometimes people get tightness in their calves or in the bottom of their feet. I recommend rolling your foot out with like a tennis ball. So that those types of stretches always tend to feel good.
Okay. Thank you for letting our viewers know that. Absolutely. What other? So let me ask you this: what do your major specialty is the training or the therapy? What are you personally specialize in?
Well, so I'm a doctor of physical therapy, so that's my first
The
thing
therapy.
is that, and it's really interesting because working at Old Bull, I'm able to really blend everything together. So I might have somebody that's here for strength training, but I don't just turn off my doctor brain. I can use it all together.
You do it all together. Yeah.
Absolutely. So it really does go hand in hand. I would say like I just specialize in treating individuals and helping them get to their goal, whether it's performance, enhancement and their, as a performance coach, or if their goal is pain free. So
Right.
that's what I specialize in.
Does Old Bull offer like any special sessions or introductory programs for like pickleball player? It's a shout out for all of our pickleball people, but something to for people to come in. Do you have programs? What is the fee? Since you don't offer insurance, how does that work?
Well, right now, what we have going on is you can, you can follow us on Instagram or give us a call, and we're offering a complimentary session.
Okay.
So that's something we can offer you guys in the pickleball community. Come in, get a feel for it, and we can discuss further what your goals are and kind of what you have in mind, and we go from there. So it's always going to be completely one-on-one, and we devise plans that are tailored to your individual needs. So there's no cookie cutter approach. Everybody's completely different, and really we just want to get you through the door, have a conversation with you, do an evaluation, and be able to provide our expert opinion on what we feel you need, what you could benefit from, because we really just want to help you reach your goals.
To reach our goals. And how much is a session?
So we have like session packages right now.
So
there's a couple different options, and depending on what works better for you, that's kind of how we go about that.
How you tailor it.
Yeah.
Okay. So for all our pickleball players, we can offer them a free complimentary session to come to your location. Let us tell our viewers your location is in Pinecrest.
Yes.
And where are you located in Pinecrest?
Yeah, so our address is 8185 Southwest 117th Street in Pinecrest. So you can find us there.
And you're also located in Coral Gables?
Yes, in Coral Gables as well. Do not have that address off the top of my head.
Okay.
I'm over at the Pinecrest location, but we have wonderful staff at both locations.
Okay. Before we wrap up our show, is there some things that you want to tell our viewers, or anything you want to say about Old Bull, or anything that you want to share?
Yeah, well, first of all, I just want to say thank you so much for having me here on your show, and to all the viewers out there, check us out at Old Bull. Come by. We're so happy to help you with whatever needs you have. Like I said, we're offering a complimentary session, and just stop by. We want to help you. We want to meet you where you're at, and we want to help you get to your goals.
Thank you. Thank you so much. Thank you so much for being here, for being on our show today. And hopefully, we will have our pickleball players go and have a complimentary session at Old Bull Athletics, which again is in Pinecrest, in right by Sunnyland, so
Yeah.
people know. And also, we have Evelyn Greer Park is right around there, so that's another good. I don't know if you get people from there, but they play there every day, Monday through Friday, from 8 to 12. So you'll get a lot
Yeah.
of people in the area that come to you.
Wonderful.
So
Yes.
that's great. So thank you for another episode with our pickleball show, and we will see you soon.